In response to COVID-19, there's a key role for community health centers. Most of these were founded in the 1960s and 70s to bridge the gap in access to primary care. They're still doing that while also facing new challenges with the coronavirus. To tell us how that's going at the Codman Square Health Center in Dorchester is its CEO, Sandra Cotterell. Thank you very much for being with us, Sandra.
Hi, Chris. Thanks for having me.
Sandra, I know the health center looks a little different these days from the outside, but for viewers worried about COVID-19, when should they be calling a neighborhood health center?
Yeah, I think that people are concerned in general, and I think that I know that the health center wants to be a resource to those that are wondering when to call, when to seek care. So you can use our website or just call us and we'll guide you through that. I think it's really hard for people to keep up with the symptoms and do they have a fever and the shortness of breath, and they're changing and evolving constantly. So I would say that if you have any concerns or any questions, just call us, and we have a team of clinicians and nursing staff that are on the lines, and will help guide you through that.
Well, imagine one of the things these health centers do, if nothing else, is you might sort of weed out some of the traffic at hospital emergency rooms.
Yes. And so the health center does look a little different. It does have a white tent in front of it. And when this hit, we had to really change the model of how we care for patients. We did not want our elective cases coming in, and we wanted to make sure that we could provide access in lieu of a hospital emergency room for those that were sick and still needed to be seen in person. So our urgent care services are open 7 days a week. We have limited hours, some on Monday through Friday. We're open from 9 a.m. to 7 p.m. On Saturdays, 9 to 3, and on Sundays, 9 to 1. And so for people who are sick and still need access, we do want people to be able to walk in and be seen. And one of the ways in which we try to make it a safe environment for all is that you are screened in the tent before accessing the health center. So we are screening people who might have fevers and trying to decide who really needs to be tested, and putting a mask on people if they do need to come into the health center to be treated.
Healthcare providers always have to be concerned about the spread of infections and protect themselves from that. But what about the way things are now with the coronavirus? There are things you have to do different. Do you have all the protective equipment you need?
Yeah, we are keeping count of that every day. So like other health centers and other providers, we have a limited supply. So we're keeping a tight inventory on it. We've been fortunate to get donations of masks and of gowns and of face shields, and we continue to solicit donations for those. Some of our partners, whether it's the Mass League or hospital partners or people that we do business with, have put us in contact with vendors that we've never dealt with before, just to really get us access to materials. So it is a journey, and it's one that every day we are on the phone looking for donation and looking for ways to get that. So we do keep a close eye on the inventory, and we make sure that those who are on the front line that are doing testing have what they need to be safe.
By the way, what happens when people get tested? I mean, do they find out within a few minutes, or is there some sort of a lag time?
There is a lag time. We are not doing point of care testing. So right now what happens is once you get tested, we send it to a lab. And once that lab gives us the results, then we notify the patient. Right now it's taking us about 2 days to 3 days to get the test results. And we are continuing to work with, again, others to see if there are ways to expedite that process.
By the way, what about the future role of health centers in testing? Do you think that's going to be growing?
I think it is. In fact, we will be expanding our testing capability, as well as a few other community health centers, where not only will we be testing our patients, but we're going to be expanding our testing to community residents. And so that we do feel like there'll be a broader role for community health centers in testing not only their patients, but the community at large, especially in the high-risk areas. And so Codman will be taking on that role.
Speaking of high-risk areas, we've seen the racial breakdowns from the city about those disparities. We've seen the map with neighborhoods more heavily affected, including, I think, the area where Codman Square Health Center is. Talk about the importance of testing as far as addressing those disparities.
And that's a good question. I mean, I do think that right now we are following the Department of Public Health guidelines for testing, and as you probably have heard, most of those guidelines are people who are either symptomatic or have been exposed to someone with COVID-19. We would like to see broader testing in our community because of what we're seeing and hearing in terms of its impact on the minority community. But right now, the supplies and the materials that are needed to do that broad testing would be at risk if we started to do more broader testing. So we are limiting our testing to those patients who are symptomatic at this point, but I'm hoping that in the future, when there is more resources to testing as well as the equipment and things that are needed, that we can broaden that.
I want to ask you about the financial picture. Health centers at the outset here of this emergency, at least, they expected they were going to be taking a hit because they had to put off other visits and streams of revenue. But since then, you know, the government has stepped up with some help. How does it look now?
It's the federal and the state funding has been helpful. However, we are still going to experience a financial hit. We have seen at Codman about a 50% reduction in our volume. We've had to furlough staff because the volume has not been there. And although the funding has helped, it will not mitigate the loss that I can expect that we'll see at the end of this fiscal year. And I don't know what that means as we look at life beyond COVID-19. I think that this has impacted several businesses, and how we rebound from this, it will be a journey that we'll have to look at. I think we're going to look different as a result of this. Right now, a lot of our patients who can't come in, we're trying to do telehealth. And so a lot has changed for us. And but the financial implications will, I think, follow us into next year.
What about telehealth? I mean, are you able to reach people the way you need to with that, you think?
Yes, some of our patients and our providers are commenting that they like it, that in some cases we're able to reach patients easily because they are on the stay-at-home order. So people are at home and it's easy to connect with them, but people have been enjoying the experience. There's some folks that still need to come through the door for labs and things like immunizations, but the experience so far is a way to stay engaged with our patients, especially given the demographics and the complexity of what we see, has been helpful.
What about mental health?
Yes, we have a large behavioral health team, and they've been part of our medical care model. So it's an integrated model. So if a clinician is on the phone with someone and they're distressed, they will connect them to a behavioral health clinician who will follow up with them directly.
I want to ask you about the disparities which are entrenched in many cities, including Boston. And on the other hand, we've seen these figures that have come out about who's affected, the racial divide there, the neighborhood divide. What did you make of those figures?
Yeah, it's disheartening to see, but I think it is our reality. As you hear, within even the Codman Square community and who we see, we have a high population that have all those comorbidities, whether it's asthma, whether it's obesity, high blood pressure, diabetes. And we're even seeing in the population that we've tested, since this hit, we've tested about 260 people. About 120 of those have tested positive. So we're seeing about a 48% rate of people testing positive. That's very, very high. So it is very, very concerning when you hear that, but it does reflect what we're seeing in our community.
Well, for people who need your help, and if they haven't been there before to the health center, what's the best way for them to get in touch at this point?
So I think two things. They can reach out to our website at www.codman.org. They can also call our call center directly at 617-822-8271. And again, I spoke about our broader testing initiative. You do not need to be a patient of the Codman Square Health Center. We will be here to assist you and guide you through the process.